let's just start with the, well, I'm not going to talk with the anatomy of the heart and physiology. Everything needs energy, everything needs oxygen. We know that. But we're going to talk about, first of all, the risk factors, what drains our heart, what makes it sick, and what makes it healthy. Okay? And then we're going to talk about also how to prevent certain conditions of the heart. So heart attack is actually not only heart attack, but heart disease, cardiovascular disease is #1 killer in the United States and in Europe. Now India is catching up, China is catching up, so it's pretty much #1 killer. And the reason why it happens because the death from heart attacks or heart disease happens because this is multifactorial. You can't just say, take this vitamin and you're going to be okay. Stop smoking and you're going to be okay. There's so many factors that actually affect your heart that it's just very, very difficult to prevent and control. Yeah. So when you go to the doctor, they check your cholesterol. Some doctors do the full cholesterol panel. Some doctors just check the LDL and total cholesterol and HDL. And we already spoke about this, but we're going to talk about this again. Cholesterol. Let's go over cholesterol quickly. So cholesterol is the fat molecule. And good cholesterol, the function of the good cholesterol, it's a building material to build your cyst wall. So this is what your wall consists of your cysts. And it also has ability to grab all these remnants that floating around in your body of bad cholesterol, collect them and recycle them in the liver. Bad cholesterol is those remnants of good cholesterol when you have a lot of inflammation, when the cells are destroyed and the cell wall gets destroyed, it turns that good cholesterol turns into little pieces that shattered and just scattered all over the place. That is the bad cholesterol. That is the one, that garbage creates plaques in your vessels, not the good cholesterol. So thus, when the doctor says your cholesterol is high, you want to make sure that you understand. So good cholesterol has to be high in order for you to balance bad cholesterol numbers. So if your number is 80 and higher for good cholesterol, we're doing pretty good. 80 and higher, that's what you need. Okay, so each time when you have your trip to your primary care doctor and you see that, that's what it is. The blood test that you're going to have with us every 4 months, we usually do 4 months after the detox and everything, includes that panel as well. So you could check and we could compare. Now, besides that, there's also a number, the ratio, there's another cholesterol called triglycerides. That is the one that creates high blood pressure. That is the one that creates plaques. That is the one that actually increases the risk of cardiovascular diseases. Okay? They do not call it bad cholesterol, but it's actually worse than LDL. It's really bad. And you know what increases triglycerides? Birth control pills. You know what also increases triglycerides? Estrogen. So if you're taking birth control pills, or if you're someone who is naturally producing a lot of estrogen and you have hyperestrogenic state, you're increasing the number of that triglyceride in your body. Not crazy. So that's why we go by ratios. We calculate those numbers. But if your good cholesterol is high, then it's basically outweighing the risk of those two. Okay. Another very important factor is hemoglobin A1C, which also when we do a blood test, we check for that as well. Hemoglobin A1C is the parameter that tells us how many of those spikes that we were just talking about on your sugar and your insulin you have in the past, let's say 4 months. If you're spiking of sugar, we don't like that. Like with time, once you start your detox, you will see you're going to spike less and less and less and less, unless if you ate something, then you spike up, maybe not high, but you spike up. So this hemoglobin A1C is the one that indicates that your spikes were too frequent. That's another risk for cardiovascular diseases, including heart attacks. And there's another very important factor, which is omega. There's a test that each of you will receive after the detox, where I'm going to include cardiac health test afterwards, just to make sure we're in a good, levels. I don't want to do it now because, it's probably not as good. We usually run pretty abnormal, a lot of us. But omega index is one of the most important protective, cardioprotective factors. That's why I'm so for carnivore diet, and I say eat sardines, eat mackerel, sardines, salmon, something at least twice or three times a week minimum, or take some good fish oil for that reason. Of course, omega is good for other symptoms, other systems. When we're going to go through your brain and other systems, you will understand that skin, everything needs omega, but heart needs it the most. Okay, omega. And that's it, I guess.